Hello everyone, in this video I'm going to talk about Verden classification on flexor tendons, zones and their injury. So this is one of the very simple topic for the exam purposes, and my notes, these notes I made just for the exam purposes, so not tidy at all. So just let's go through. It won't take much of the time because it's a very simple topic. So let's begin. So first of all, as we know, flexors muscles, flexor tendons, they are present on your anterior side. So if we are talking about the anterior side, of course we are talking about your palm side. So if your thumb is on this side, then of course this would be your, if this is the palm and this is your thumb, we are talking about the left hand. So here we can see, according to this classification, there are 5 zones for this flexor tendons injury. So let's begin. So first of all, your first zone 1 is somewhere here. Zone 1 is from your insertion of your basically middle phalanx, or we can say FTS, flexor digitorum superficialis, gets inserted. As we know, FTP, flexor digitorum profundus, they are the one which goes much more distal. Remember the mnemonic, easy to remember thing is FTP, yeah, flexor digitorum profundus. So D is for your distal. So flexor digitorum profundus, they are the one which always go much more far, much more distal, yeah. So therefore FTS is because I've seen most of us when we used to study flexor digitorum, FTS and FTP, their insertion was always a very confusing thing. So the very easy to remember is which one goes much more far, which one goes much more deep, is by remembering FTP. FTP, D for distal. So FTP is the one which goes much more distal. So all right, so here is your zone 1. So zone 1 would be FTP. It includes FTP and is from here till here. Yeah. So from your middle phalanx all towards distal, towards the distal side. So there it would be a zone 1. Then if we talk about the zone 2, zone 2 would be all this area, and it's same for the each finger. So I'm not describing each and everything for each and every of these zones for each and every finger. So that's why I've just taken the example of little finger here. So zone 1 I already said, and everything far from FTS insertion, that is, it would include FTP. So that's zone 1. If you talk about the zone 2, zone 2 would be your distal crease of palmar, your distal palmar crease or your distal palm crease. Most of us have this, yeah. It's present in most of individual on their palmar side. It's a thick line crease which we can see on your palm side. So zone 2, also called your no man's land. So this is the one, your zone 2. Yeah, it would be here, 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 everywhere. Yeah, this one from here till here, from here till here, from your distal middle phalanx of your FTS insertion till your distal palmar crease. So these 2 zones are completed. If we talk about the third zone. Now third zone, again, it is very simple. Here was your distal crease, palmar crease, palm crease, distal palm crease. Here is your distal border or distal margin of your carpal tunnel, because here is the carpal tunnel, yeah. So if here is your transverse carpal ligament, that is your carpal tunnel, the distal margin of that, yeah, distal margin of that and the distal palmar crease, they both, the third zone would be between these two, yeah. A1 pulley also is here. So between these two. Then fourth one would be superficial or including your carpal tunnel, yeah, all the area, your carpal tunnel, even superficial to that. So that would be your fourth. So fourth one is very simple, very easy to remember. It includes your carpal tunnel, yeah. Fourth, all the tendons passing through carpal tunnels or even the superficial. So everything is basically it's all about the carpal tunnel inside, because as we know, most of the tendons and everything goes from carpal tunnel. So this one is your fourth one, carpal tunnels. All right. And fifth one would be your proximal crease, proximal border, proximal margin of your carpal tunnel. Everything from your wrist, forearm, everything above. That would be your zone 5. zone 5th. So a quick recap: zone 1 from your middle phalanx distal, zone 2 from middle phalanx till your distal palmar crease, zone 3 from distal palmar crease to till your distal margin of carpal tunnel, zone 4 would be your carpal tunnel, and 5th would be everything and your proximal margin of your carpal tunnel. So anything, all the tendons, we must know which area has been incised or injured. So according to that, we need to manage those patients. So it's a very important classification, but one of the most simplest classification which I have gone through in so many in medicine. So it's very easy and very easy topic. All right, thank you.